Big Money Bound TV, RRT Posse, thanks for tuning back in. If you're new to my channel, go ahead, like, subscribe, share the video with your family, your friends on Facebook, on Instagram. Do what you gotta do, man. We trying to get this channel to 8 million. A million. Now you're gonna hear an echo because, as you guys know, and if you don't know, go watch the video. I'm gonna drop it right there. Hit a little bubble over there or over here, wherever it's at. Click on it. I just purchased a new house, still getting furnished. That's the reason that you hear an echo. But hey, still Big Money Bound TV, still RRT Posse. And what we talking about today is working in the ER as a respiratory therapist. When I was in school, this was the one place that I was the most scared and fearful of working because I wasn't a real big fan of not knowing what's gonna come through that door and just having to be ready, know what to do, and be prepared. That was the scariest thing to me ever, man. Like, the one place I did not want to work in the hospital was in the ER. You could send me to the unit, to the floors, pediatrics, anything but that ER. Please, man. So that was what I was most fearful of. That's when I was in school. So I started, once I graduated and I became a therapist, I say within about 11 months into the career. 11 months into the career, they saw that I was like a strong therapist. I didn't really need too much help. And if I did, I wasn't afraid to ask for it. So one day, the lead therapist that was supposed to come in didn't show up. So the person that was in the ER took the lead therapist position, the supervisor position. So they had to put somebody in the ER. And who did they choose? You guessed it. It was me. I hadn't even really oriented in the ER, except during my 3 days of orientation, 3 days of internship when I was in school. Besides that, I had no clue. But luckily, I had did my internship at the hospital where I work at for the ER rotation. So I was a little bit familiar with it. But like I'm saying, I had been in the field for 11 months, and that was about 3 months on top of that ago, so that was more than a year ago. So they put me in the ER, just put me down there. I am scared, man. I'm trying to convince them otherwise to get me out of the ER. They're like, all right, Randy, you going to the ER? I'm like, nah, man, don't send me down there, man. I told them straight up, I'm gonna hurt somebody, man. I'm gonna hurt somebody. I'm trying to scare these folks. They just laughing like, man, you silly, man. I'm trying to convince them that, hey, you see me down there? I'm gonna hurt somebody. They said, hey, man, go on downstairs, man. You'll be all right. Okay, man. So I get down there. The crew leader, she shows me how to, because the whole documentation is different from the ER and on the floor. So it's a whole new documentation system. It's a whole new scanning system. It's a whole new order entry system. She showed me all of these steps. Give me about an 8-minute little trial or pre-course. Show me how to use everything. 8 minutes. Then she gone. I'm down there scared as hell, man. She showed me where all the vents at, where the ET tube holders at, where the portable ventilator at. I'm down here scared as hell. I remember like it was yesterday, man. I'm down there. I started my shift at 6:30. I see that phone and started ringing to about 7:50. Got my first call. Bling! It was like a normal, just a little breathing treatment. All right, that's cool. I can do that. I know how to do that. Hook up my breathing treatment, tell the patient who he is, what you're doing. Okay, cool. Contraindications, side effects. Okay, cool. Then they gonna call it for treatment. So I got 3 or 4 treatments pending while I'm in here giving this treatment. Then they call on top of that, I need a stat ABG. We need a BiPAP set up over here. I'm like, man, how the hell am I supposed to do all of this? It's just me down here. So I'm writing everything down, like who called me and what order, what to go and do. So I get a treatment, I run the ABG, then I put that patient on BiPAP. I had a critical value on the ABG. I'm gonna go and let the doctor know. On my way to get him, it's an emergency intubation coming. So now I gotta not notify him. It was just like the PO2 was like 70 on room air. Oh, the PO2 was like 70 on 50% venti mass. So we need a lot more oxygen. I know that. That's no problem. Put him on 100% oxygen. But I didn't, the doctor still isn't notified yet. Cool. Go do this emergency intubation. Do that. Paramedics helping me. One thing I say about ER staff, man, the paramedics and the nurses are very like hands-on with helping you when it comes to these intubation situations. Because you gotta set up the vent, you gotta get the vent ready, you ambooing and bagging while they getting the ET tube ready, and all this stuff gotta be done like this right here. There's no time for, okay, I got everything set up for when they come in, I'm ready. No, they just came in now, and you gotta do this stuff rapidly. So that's a big help to have people that's willing to set up the ET tube, check the cuff, have it ready for you, and just hand it to you, hand you the CO2 detector, just hand everything to you while you're bagging and helping the doctor at the head of the bed. So that's a big help. So they was doing that. We intubated. Someone was willing to hold the tube while I secured it. That's a big help. They was willing to bag while I was setting up the vent. I'm like, damn, this is kind of, you by yourself, but you're still with the ER staff. This is kind of, all right. I come out of there. The doctor, who I did notify, who I was on my way to notify about the PO2, caught me in the hallway. Hey, man, you kind of new down here, right? Yeah, you come and you let me know. I'm like, yeah, I was on my way to do that. Yeah, he said, next time, just let me know. And walked off. Dog, you all right? But he's 100% right. That never happened again. But like I said, I'm not even supposed to be down here. I'm scared. So hey, it happens. So I get that little rush. Put the patient on BiPAP. Do a follow-up ABG. Everything is good. Do a follow-up ABG on a patient that had the venti mass with the low sats on 100%. Everything is good now. We good. I'm down there now. We got an ER office in it. We got an ER respiratory therapy office down there. So I'm down there, man. I'm just thinking to myself, man, please just let me get out of here, man. Don't let nothing crazy happen that I don't know nothing about, that I can't do. But then, that was the first time they sent me down there. Didn't have nothing crazy happen. It was just respiratory therapy, but in the ER. Like, it's all respiratory therapy care. If you know respiratory therapy, you're a therapist, you can work anywhere, literally. But you just gotta like have the confidence to do so. So I finished up that night. I'm like, man, I made it, man. So all my coworkers are like, hey Randy, how was it? I know you've never been on. How was it? Did you come across anything that you didn't really know or understand? I'm like, yeah, I did. A lot of stuff I didn't understand. They said, what did you do? I went to YouTube. I use YouTube, man. He went to rolling, man. I use YouTube. Y'all sit down, I didn't know what I was doing. I use YouTube. I'm trying to prevent them from sending me down there again. But these people know I'm joking. They know me. They know my personality, but man, they know I'm just talking crazy. I come there. The next day, I'm in ER again. I'm like, damn. Well, it wasn't too bad last time, and I'm able to do it, so whatever. And then, that's just how it started happening, man. And every so often, it went from that day to the following day to like every 3 weeks I'd be there. Every 3 weeks. Then it went to every 2 weeks. Then it went to like every 6 days. Now it's going, bro. It's like every 3 days. My last 4 shifts at my job, I worked all ER shifts. So, and it's just like, it's easy to me now. But it's the same job I was doing when I was afraid that I'm doing now. It's just that I'm more comfortable, I'm more confident in repetition. There's nothing that comes in the ER that I can't handle. And if it is, we got help, supervisors, coworkers. Only time I really called for help when there was something I felt like I wasn't comfortable with was when we had a pediatric patient come in unresponsive, needed to be intubated, that kind of thing. Whether I know it or not, I know my job, I know this or that. 2 heads are better than one, and this is a pediatric patient. I want to have the most help I can out here for this little kid. So that's when I called, hey man, got a pediatric coming in. They said 5-6 minutes, come down here and help me out. Okay, cool, no problem, I'll be there. And we took care of it, no problem. That's when I called help, and I was like, you know what? I know I can do it, but I just want to have another therapist with me. Nothing wrong with that. So that's how the ER came about, man. I'm an ER therapist, man. I was scared as hell. So working the ER, what you can really expect to see and experience, every day may be different. You're going to have some days, you're going to come into the shift, it's going to be 4 or 5 ventilators running as soon as you get on. So you got to pick up with other therapists left off, doing vent checks, suctioning, and you got to transport all these patients up to the units on a portable ventilator. So you got to hook them up to the portable ventilator, get the portable ventilator circuit, make sure you got an ambu in the bed while you transport them, because you never know, something may happen. While giving report to the therapist that's going to be receiving the patient, to all of your patients, you got to do this. On top of that, in between those transports, you're still doing breathing treatments, you're still doing emergency intubations that they come in, you're still doing BiPAP setups that they come in. So that's a busy night. You can come in there some nights, everything is empty and slow. The therapist, before you answer the phone, hey man, I had a great night, wasn't too busy. Cool, so you walk into it, you don't see nothing. Nobody calling your phone, you good. You think you're gonna have a great night. 2 hours later, 30 minutes later, bring, 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 bring. You swarming at work, man. Intubations, BiPAPs, ABGs, conscious sedations. You doing conscious sedation. They're like, yeah, we need you for conscious sedation in this room. I'm like, okay, no problem. I'll call supervisor. Hey, they need me for conscious sedation. What is that? Okay, you're just gonna hook up the nasal cannula CO2 detector. You put that on the patient so we can monitor their CO2 levels. They're gonna sedate the patient and put them out while they like put a joint back in place. Like you could have been dislocated your shoulder, your hip, your ankle, wrist, a lot of things that they're just gonna put back. They're gonna put it back in the socket and put a splint on. They want you to be there in case anything goes wrong with the sedation or the patient isn't waking up, isn't aroused, or isn't coming back around. So now we ambu and we intubate. That's why they need you there. I never had a time where I had to intubate somebody that had just got done doing conscious sedation. So you got to do that sometimes. At first I was like, oh man, what am I doing with them? What do they want me to do? They want me to do respiratory therapy. That's what I am, a therapist. So once you will understand that you just doing respiratory therapy, you're doing your job, nothing more, nothing less, it's all the same. There's really no need to be afraid because you're a therapist, you got your license, you know what you're doing. So you can have that kind of night. You can have a night when you go down there, your phone is ringing off the hook till you get in there. Then an hour later, you don't hear your phone ring a bit. You going there looking for it like, hey man, do y'all want me to do something? You in there sweeping, picking up garbage, just trying to do something, man. So that's kind of why I like the ER now, especially during busy season. You be like, why would you like it if it's busy? Because during busy season, the ER is still a gamble on whether you're going to be busy or not. It's still a gamble about who's going to come in and come out, what's going to happen. That's a gamble. It could be crazy busy. Could be easy. Could be nice and slow. But on the floors, you know for sure, you got 1 million treatments, 1 million vent checks, all of that. Now you may be just as busy in the ER as the people on the floor, but it's not a guarantee. It's a guarantee that everybody on the floor is going to be busy. So when working the ER, man, you never know. You can see 2 patients to 42 patients to 52 patients, man. You never know what it's all about. The luck of the hours, man. But hey, and that's what it's like, man, working the ER. It's the ER. You don't know what's coming. You don't know what's going. It's hectic. You gotta just stay on your toes and be ready and be prepared. And one tip of advice: have all your stuff prepared. Hope for the best, but plan for the worst. That's it. Make sure you got all your ventilators ready to go, circuits on them, set up. You got your ET, you got your hollisters on top of the vents, so that can be a nice and easy transition. You got your BiPAPs ready and set up to go. You got nebulizer bags and treatments. You got your nebulizers already ready in their bags. You got everything set up for when you need to be called. Don't think, oh, they're going to call me and I'm going to go grab this, I'm going to go do that. No. have this stuff ready before they call you. So when they do call you, just go grab something and it's nice and easy. You don't want to be saying, all right, we're going to intubate a patient in bed 35, but you don't got no vent. All right, let me go get my vent. Let you go do what? Let me be your last day at the job, dog. But hey, Big Money Bound TV, thank y'all for watching, man. All my loyal subscribers, all my new subscribers, please tune in every Monday, 12 o'clock Eastern Time for scheduled respiratory therapy videos. Turn on post notifications so you can get these random videos I'm dropping throughout the week. That's going to be more like the lifestyle, what I'm doing this day, what I'm doing that day, maybe respiratory therapy videos. Also, you never know, so turn on your post notifications. Thank y'all for watching and tuning in. I appreciate it. Big Money Bound. 4 is up, forever ambitious. That's it, man. I know y'all see the Nikes. But hey, Big Money Bound TV.